Hi, I'm David King-Lassman. This is another episode of ExploreXR, and I'm absolutely thrilled to be joined by Dr. David Rhew, the Global Chief Medical Officer for Microsoft. Dr. Rhew, it's such a pleasure. Thank you for joining me today.
Oh, it's my pleasure. Thank you, David.
Um, so I'm going to start off with this. I did a little bit of research, listened to some of the interviews you've given in the past. Your early passion was video gaming and engineering. And I'm curious to know how a young man who probably spent lots of time playing video games and thinking that he wanted to build them for a living went from there to medicine.
Well, I don't know about thinking about building them for a living. I did it because I thought it was fun. Keep in mind, back in the 1980s, there was never this idea that you could make a video game and monetize it. We just had these big arcade machines, and I always thought it was so cool that you had these amazing experiences all within a machine. And I wanted to just be a part of that movement to find some way to express my creativity. And then if I would have been a little bit more forward thinking, I would have realized that we could have monetized this and made this into a billion-dollar gaming industry.
Right. I dare say you probably don't have much time to play anymore, right?
Yeah. Well, I do really enjoy computers and video games, but I'll say that most of what I do nowadays is trying to find ways that we can apply technology in ways that improve people's lives.
So you went from in your early studies from engineering into medicine. Did you practice as a physician?
I did, yes. In fact, that is really how I started. I started as a clinical professor. Actually, I was associate and then full professor. But largely, my interest was on research. I was interested in studying how technology could be used to improve health outcomes, access to care, quality of care, patient safety. And what I found was that if you provide the right information at the right time, you could change behaviors. And that was something that was interesting because I had always assumed that healthcare was consistently delivered across all types of venues, all geographies. And when I realized that we could have a direct impact just simply by providing information, that was something where I realized that I could do something that would be fairly simple, but it could have a direct impact on patient outcomes. Now, that was all done initially on paper. But as soon as my projects were over, I realized that I couldn't sustain this because I just can't be around everywhere. So that's when I realized that technology had to be a big part of the strategy for how you make this scalable and sustainable. And
Right.
that was when I started working with some folks to create some software that essentially became a company that was acquired by another company called Cerner, which is a large health IT company. And next thing I knew, I was in the world of electronic health records and digital health.
Which is kind of lovely because that early interest that you had in engineering came full circle, and now you're applying that in the medical field. When we think about Microsoft as a brand, Global Chief Medical Officer doesn't seem like a position that instantly springs to mind. Can you talk a little bit about why Microsoft has a Global Chief Medical Officer?
Well, one of the things that I think is really interesting is that there are many consumer technology companies and companies that you would never normally associate with healthcare, creating some amazing technologies that could be useful to transform the delivery of healthcare. And what has happened over the past several decades is a quite remarkable transformation in how care is delivered. First, we saw the electronic health record, which began to enable people to digitize these paper records into forms and into data elements that could then potentially be managed in a more effective manner. And now what we have seen is that there's a second wave in which the data itself, whether it be lab results or x-rays, patient information, can also be better managed. And this is requiring us to think about how data can be used and combined in ways to be able to gain insights on where individuals are heading, to be more predictive. And that requires a cloud infrastructure with artificial intelligence. And so now companies like Microsoft are realizing that the technologies that we have could help transform the way that care is delivered and the experiences that patients have and providers have. And it's largely based on the fact that there's this underlying technology infrastructure. So at Microsoft, our mission is to empower every individual and every organization to be able to achieve more, to be able to think beyond what's currently possible. And what I do at Microsoft is I work very closely with our clients and our partners to be able to help them understand how those visions and those aspirations can be translated into technologies that will help them on their path to achieving those goals.
Right. So we're coming out of the pandemic. Life seems to be returning to some semblance of normality, but it must have been an incredibly interesting time at Microsoft during the pandemic, because no doubt some of the tools that you were developing suddenly had a new resonance, right? Because they were so impactful. Can you describe what it was like during the early months, and then as we moved further into the pandemic, how it influenced the thinking at Microsoft from your perspective?
Well, I'm also an infectious disease doctor, so I had a very particular interest in helping support all the different initiatives that we saw. And it really didn't start off as anything more than just wanting to help and just trying to lean in. And the more that we realized that there were so many unmet needs, that's when we began realizing that technology could be an important part of our strategy to battle the virus. One of the first things that we saw was that there was a need for information that could be disseminated and individualized to large populations. So, while we have websites today that people can go to, a lot of that information wasn't set up in such a way that it answered a very specific question. What do I do? I've just been exposed to someone who has recently traveled and I have a fever. Do I need to go to the hospital? Should I get tested? I mean, these type of very specific questions everyone in the world was having at the same time. And so that's when the use of a chatbot that was customized to answer COVID questions became extremely important. It was actually one of the first innovations that we saw that had a global impact, because everyone needed that information and we needed to update it as guidelines and recommendations continued to evolve. And then what we saw was this need to identify where can we get the vaccines? How do we deliver the vaccines to where it needs to be? What's the most effective way to identify areas that are at highest risk? I mean, this was all data that was in many ways absolutely vital to the strategy for how we would perform our vaccination rollouts. And this was at the country level, at the state level, at the local city level. And this, again, was an area where Microsoft began leaning in to help with technologies that could help individuals register and schedule for the vaccine, that could allow them to be able to understand where that data could then be, how it could be captured and secured and sent to immunization registries. And that was, for me, a real exciting opportunity to better understand how we can use technology to be able to address public health issues.
Right. And healthcare systems on a global basis, I mean, there are terrible inefficiencies because they're so big and they cover such a wide area and so on. So it must be really exciting when technologies that you're developing are helping to address those inefficiencies and making the system work better, which ultimately, of course, is going to drive patient outcomes, right?
Absolutely. And I think one of the things that we have been struggling with for quite some time is just making that data more interoperable. And it became so apparent during the pandemic that our systems are broken. I mean, we had people faxing and emailing documents to central agencies just to let them know where the PPE was, the personal protective equipment, masks and gloves, and, understanding where organizations had beds and ventilators. And this was just unbelievable. We had never seen such an urgent need to have information, the right information at the right time, for organizations to be able to function and be able to provide care to those who needed it.
Right. So we could talk about this all day long, but of course, our focus here is on XR, extended reality. Now, Microsoft's taken a very interesting position in the development of the HoloLens. How involved were you, or how familiar are you with HoloLens, and what impact do you think that type of medium, the mixed reality medium, is going to help drive the healthcare sector that you're so passionate about? And I guess in particular, as opposed to virtual reality.
So prior to joining Microsoft, I spent 6 years as chief medical officer at Samsung, where I helped work with many organizations, both like some of our partners and clients to implement virtual reality solutions to address healthcare needs. So things such as using a VR headset to address PTSD or to alleviate pain, to potentially even get patients off of their opiates. These were all really exciting and impactful innovations, but the limitations to the VR were that it didn't allow you to be able to see the real world while you were experiencing it. It was a very immersive experience, but it didn't have a chance to actually see and interact with the real world, which is where the mixed reality comes in, because it's got this you have the capability with using the headset to not only see superimposed images, but use the artificial intelligence that drives this to be able to create holographic images, manipulate them, pull information from different sources. And this has created a whole series of different use cases, everywhere from education training to skills development, potentially to help address issues like the nursing shortage. So we can train nurses to become proficient in their skills in a more rapid and more efficient way than they currently are. And we also have seen the opportunity to take some of these information sources from existing systems like CTs and MRIs and combine them and make three-dimensional holograms that surgeons can use for preoperative planning. And in some cases, identify patients that they may not have felt comfortable doing a surgery, but because they have this new information, they feel confident that they can actually remove those tumors. And so now we're starting to see opportunities where it can be used in the clinical practice. There's just so many exciting opportunities to be able to use this when you think about the fact that you can interface with the real world and have the virtual element on top of it.
Can you describe, I mean, you've hinted at it, but of some real world examples of some mixed reality applications that you've been especially impressed with?
Well, I think one of the things that has given me the greatest insight is when I hear about cases that have dramatically impacted a person's life. And there's a wonderful case study that came out of Nicholas Children's, where an individual, a young child, was diagnosed with a tumor, and it was deemed to be inoperable. Went from place to place, and the surgeons just didn't feel comfortable being able to remove that tumor. And what happened was they went to Nicholas Children's, where they were using the mixed reality technology, and they were able to reconstruct the tumor and then understand all the different ways that this interfaced with the bone and the nerves and the arteries, and they were able to carefully construct a surgical plan to remove that tumor. It gave them the confidence to be able to do things that they couldn't have done before. And ultimately, they were able to remove the tumor. Now, this is an amazing example, because had they not had this technology in combination with 3D printing, which they use as well, they couldn't have felt confident to remove it. And ultimately, who knows what would have happened. But in this scenario, they were able to feel the confidence to be able to do that and successfully achieve their goal. We have actually seen this similar type of scenario play out in other settings, where you can now give individuals the confidence to be able to perform procedures, to be able to understand what needs to be done through consultation, where people are in the back providing them with the right information at the right time. We have seen in the UK during the pandemic, where an individual at Kendall Home, which is a nursing home, they essentially do bedside rounds, and then the GP is in the back, watching them, so they can turn the patient, look for bed sores, they can look to see at the IV site, and they essentially, almost as if the GP is right there, is able to manage that patient. It allows us to be able to rethink what's possible from the perspective of virtual care.
Yeah, which is incredible, and something you simply cannot achieve in a fully virtual world, of course. Now, I know you're a big fan of AI. Can you talk a little bit about how you think AI and mixed reality can merge together to drive outcomes, and perhaps provide some examples of where you think that might go?
Well, several of the things I've already described are actually AI, because what we're doing is, it's not just simply creating and superimposing an image on top of the reality that we see in front of us, but it's making that image interactive. It's allowing us to be able to manipulate it in ways that require some level of understanding of what the existing infrastructures are and how they would change with different adjustments. So with the example of the CT MRI, I mean, that is a patient CT scan or an MRI being put together into a three-dimensional hologram that you can expand, you can shrink, you can rotate, you can label it, you can start removing parts of that. And all of that is artificial intelligence. We are starting to see artificial intelligence in the form of voice, where we can use voice commands and activate and pull up information directly from medical records or perhaps from the internet, using voice commands, moving things. So we're starting to see AI in that capacity. We're starting to see AI in the form of text, where you maybe there's a piece of information that was written or it was in a structured format. It can read and understand it and present it back to an individual. And so these are all examples of how AI in different formats, I'll call it voice AI, image AI, text AI, all translating these unstructured forms of information into structured formats that can then be managed, manipulated, and ultimately used by clinicians and other individuals.
Right. So we're fortunate that we've been involved in some groups where companies are coming together, industries coming together to help drive to drive this industry, to drive this medium, mixed reality in particular. One of the things that I've been interested by, we've always thought that we look at the big companies like Microsoft and Google and Meta, and we always imagine them to be very competitive, right? You're often competing in very similar spaces, particularly things like cloud computing, which is very important to Microsoft, very important to Amazon. And yet, what's fascinated me is watching you guys come together to actually talk, collaborate, imagine, right? Is that something that's unique to healthcare, or does that happen on a wider basis? That was very exciting to me. Can you talk a little bit about that?
Well, I think, similar to how when you have sports figures compete on the field, but then afterwards they grab a beer together. I mean, we ultimately are all working towards the same goal. How do we achieve better healthcare through the implementation of technology? We share a lot of the common desires towards making healthcare data more interoperable, towards empowering consumers with their own health information, towards creating more seamless experiences. So I think these drive us towards collaboration, finding ways that we can work together. I was the former chair of the Consumer Technology Association's Health Technology Board, where many of us that are on the technology side began to realize that, hey, we're better together if we can work to get towards building these standards, to helping educate consumers, advocacy groups, agencies, regulatory bodies on these topics, looking ahead, identifying the challenges that we can, work together towards. So I'd say there's so many opportunities for us to collaborate as industry partners on these important topics, but at the same time, try to create the best products that will ultimately, generate opportunities for our companies to grow.
Which is really interesting, because what's driving that, and you said it, is this desire, this need to improve outcomes, which is, sometimes could potentially conflict with the business imperative of making money. Is there a balancing act that you have to perform as a senior executive of Microsoft, where you've got to answer to to the board, which is delivering results, but also it must be incredibly exciting when you describe that example of that child's life that was saved through the technology that you've helped innovate. What's the tension like there between those two forces?
Well, I think you're hitting on a really good point, which is that when we are thinking about how we can build solutions that are sustainable, there has to be a business model behind it. And what we have found is that the way that our business model works best is when we empower our clients and our partners to be able to help them achieve their goals through technology. It drives business, it aligns incentives, and ultimately we are able to do the things that I think we're going to lead to better good. Now that is sort of our model. We've realized that in order to do that, there has to be a high level of trust. And because of that, we have been very clear that our objectives are not to compete. We're not here to monetize the data. We're fully transparent with our objectives, and we're here to try to use healthcare technology as an enabler. I think that is something that is central to what we do. But if we didn't have a business model behind this that ultimately was something that was sustainable, these efforts will not be long lasting. And so we know that part of what we're doing is just doing what's right and doing what's good for the industry. But we also have realized that we play a very specific role, specifically in terms of providing the cloud capabilities and the artificial intelligence and the ways that we can help support organizations in ways that are cost efficient for them, but also highly effective.
Yeah. And of course, you've missed out the device, the HoloLens, which, as far as we're concerned right now, is the best mixed reality device on the market, and one that we're seeing through the work that we're doing at GigXR really helping to drive outcomes. And, we're seeing, standards improving, people being upskilled quicker through this sort of mixed reality experience. And that's going to have a trickle-down effect to driving patient outcomes too, we believe. And I think mixed reality plays a very, very important role in there. Now you're working with Meta. This is widely documented. Of course, Mark Zuckerberg has a very specific vision of the metaverse. If I would ask you, David, metaverse, where do you think that's going to go? How are people going to, when somebody says the metaverse, how are they going to think about it? How are they going to experience it?
So I look at it from the perspective of, from a healthcare perspective, in terms of how we can extend our reach to be able to help engage patients and consumers in ways that they probably wouldn't have normally been able to do. So a big part of what I'm thinking about is, let's start with virtual care. Virtual care today is oftentimes viewed as telemedicine and maybe remote patient monitoring. Well, now what we do is we have a new capability by using the HoloLens and the mixed reality to be able to extend care into areas that we hadn't, by providing a new unique experience in a world that is partial reality, partial virtual. And so that to me is how I see the metaverse playing out. It's leveraging the fact that we've got newer technologies that can create both immersive as well as semi-immersive experiences that will allow us to be able to address things that are, from a healthcare perspective, things that we couldn't have done efficiently in person. Now, there's also going to be a social element, and we know that a lot of people are going to be interested in the social aspects and the gaming, and then maybe the aspects that relate to how you interact with people. I think that might create a new opportunity for us to think about how to do engagement. But, again, largely what I would like to be able to take away is how we can rethink some of the current models of care, models of how we do education, training, skills development, how we can deliver care in a more remote, highly effective manner. All of those things we can reimagine with the metaverse. So I'll use the education, since I know GigXR has done some amazing work in that space. But let's think about, just in terms of medical students and nursing students learning anatomy and learning types of, different types of things. Well, that's one stage of a person's career. But the very next stage will be they'll be doing some clinical work. Again, they need to have a different set of learning objectives, and in many ways they have to learn in a highly efficient, effective manner. Now let's imagine they're a junior attending. They have a different way of learning. This time it's more through collaboration. And now imagine that they're a researcher, that they're now studying the next coronavirus or the next treatment for that. Well, now it requires a higher level of collaboration and coordination. And with each person, if you think about a professional as being a constant learner, always learning at every stage of their journey, now what we have is an opportunity to think about the metaverse as that platform that allows us to be able to create that education learning across that entire spectrum. And so that's what I want people to think about. Not so much the avatars, which I think people are oftentimes focused on, but the fact that we've now got an environment that can help us on our journey at every stage of our career.
Yeah, I'm sorry, just processing that. That's a wonderful way of thinking about it. And of course, one of the things about mixed reality is that you can bring those collaborators together, even if they're on the other side of the planet from each other, right?
That's right.
Yeah.
And that's so important because what we're finding is that our knowledge is limited by what we can gather ourselves. We have to collaborate with individuals that are focused on the same area. And we have to collaborate using the same type of information sources that we're investigating. If it's a particular patient case, if it's a particular model that we're trying to study, we have to have that in front of us so we can work almost as if we were standing side by side looking at this model and evaluating it together. And that can only be done either in person, which is highly inefficient and ineffective because we just can't always be gathering together, or it can be done virtually. And that's where the opportunity for the metaverse to really transform advancements in healthcare, advancements in science, and rapidly accelerate that.
Wow. So I try to imagine being in your position again, being, a senior executive at one of the biggest technology companies in the world. Often I ask people to imagine where things are going to be a year from now, 2 years from now. You presumably have the power not just to imagine it, but then to influence it, impact it, and make it happen. So, David, where is this going? What is the vision, if you can share it at Microsoft, as to, there are limitations. We know there's some technology that we would love to have today that just aren't there yet, like haptic technology, for example. Where do you think this journey along extended reality is going to take the healthcare profession in the next year, 2, 5, 10, 20 years? What do you imagine is going to happen?
So for me, one of the things that I'm most passionate about, I love the innovations. I love the fact that we're doing things that we could never have done before. We're starting to see the reality of how that can be made possible through extended reality. But at the same time, there are a large number of individuals who have not yet been able to take advantage of these technologies and even basic services. These are individuals that have poor accessibility because of poor hearing, vision, motor, cognitive skills, dementia. These are all conditions that oftentimes we don't have the technologies to help address. And what I would love to see, and what I'm excited about, is when we think about applying this through the lens of health equity, finding ways that we can make this so that everyone can take advantage of this type of technology. That means we're going to have to do a little bit more than what we traditionally do. We're going to have to find technologies that can make it easier for people to see and read. One of the really breakthrough technologies that has come out of Microsoft that I'm super proud of, but it's not so much of a product per se, but it's just an innovation, is that we have an ability to help the blind manage the world around them by using these glasses that can see what's in front of you, and it reports back to you what you're seeing. It can read menus if you have poor vision. It allows you to be able to understand who's in front of you, what their expressions are, and those type of technologies that are allowing us to be able to be inclusive and address these unmet needs. That's what's going to change the world, because then what we're doing is we're lifting the entire sea so that everyone can take full advantage of this. So while I love the advancements, and I know that there's going to be a certain number of folks that will take full advantage of it, it's when everyone takes advantage of it that we're going to really see the biggest impact.
Wow. That's a wonderful vision, isn't it? The idea that we can sort of democratize healthcare to the extent that no matter where you are in the world, no matter your means, you're going to be able to be a beneficiary. And there is a tremendous divide today, isn't there, between the haves and the have-nots. Now, I'm not just talking about in developing nations, but even right here at home in North America. What's available to you in the big metropolis is very different to rural America. So that must be incredibly exciting as you go about your business.
And that is exactly right, because think about it, the haves and the have-nots. If you live in a city that has a really good hospital with some really good physicians, you're in the haves group. But let's say you're in a rural area that has very limited access to specialists. Let's say imagine you're in a country that has very limited access to even healthcare. We can democratize all that with extended reality. It allows us to be able to think about how care, the best quality, high quality, low cost care can be delivered to anyone, anywhere, at any time.
You know, that feels like a really good place to end the conversation. I know we're a bit constrained by time today. Um, I want to thank you, not just for joining me on the podcast today, but I'd like to thank you for the contribution that you're making to the healthcare industry as a whole. I notice it. People around us notice it. We're grateful for the work that Microsoft is doing. Thank you so much for joining me today.
Oh, it's really been my pleasure. Thank you so much for having me.
I'm David King-Lassman. This is ExploreXR. Thank you so much.